I am pleased to present the Robert Wood Johnson Foundation Award for Health Equity winners, individuals who are changing systems to achieve health equity. The winners are addressing entrenched issues that contribute to health inequities and forging systems change solutions. 9 organizations have been selected to administer the program. Each of the grantee organizations shares our vision for building a culture of health and achieving health equity in the nation. The winners are dedicated, amazing individuals who are pioneering game changers in the work that they do to develop and implement solutions for achieving health equity. Our award winners' stories share several themes: community engagement, partnerships, risk-taking, and thinking outside the box. We asked our winners of the Robert Wood Johnson Foundation Award for Health Equity to share their insights. Here they are, in their own words.
Health equity, for me, is offering basic health primary care to all individuals so that they can live normal and healthy lives. That means not just primary care, but specialty care when they need it, and of course, like I said, preventive care, so that they don't end up, you pick up cancers early, you have medical illnesses like diabetes, where you don't lose vision, you don't have kidney disease, you don't lose limbs. It's health care for all.
When I get into my clinic behind closed doors, I always have patients cry when they talk to me. I ask people to tell me their life story. These are really remarkable, resilient, good people who have almost universally experienced really challenging life circumstances, even from childhood. These are individuals who are survivors of structural inequalities. So when I first sit down with patients, I say, I want to get to know you as a person. Tell me about your life story. I can't tell you how critical it is for a doctor and for a healthcare system to know the patient as a human.
People have not equal health care, but that they have the equity of services that are going to move them up that economic ladder. So, for instance, it's not enough to give someone the health care, treat them for hypertension or for the diabetes, if that person doesn't have the money to pay for the medication, if that person doesn't live in a neighborhood where they can actually exercise for the diabetes. So for me, equity is really making sure that we are looking at all the things that are surrounded around that community, around that environment of that family, and saying, what can we do? Going beyond the medication, going beyond the stethoscope, going beyond, listening to their mental health issues, is what's outside in the neighborhood that's supporting that individual so that they can actually move up that economic ladder.
One of the things that I'm fighting for in the work that I do is making sure that everyone has access to that, and that's what health equity is for me. But a lot of it's also information, and a lot of it regarding HIV, stigma. It's just negative stigma. I mean, people still think that you can get HIV from touching someone, and it takes a lot of courage for anyone, especially within the LGBT community, to seek those resources. And I think health equity is encompassing education, access, and making sure that those folks feel safe and comfortable reaching out. And if they can reach out, we as a society and as a community need to do a better job of calling them in and reaching out to them.
We see health equity with Live Healthy Gwinnett providing everyone an opportunity to experience whatever goal they have in mind to improve either their health or their family's health or their community's health. We want to create the connection for them if they're not quite sure who has a service or resource that they're looking for, whether it's healthy eating, recipe conversion, if it's stress relief and meditation, or if it's preventative care and screenings that they're not aware of or they don't know that they're eligible for. We are here making that connection towards health equity to make sure everyone has access to those opportunities, no matter what community they're from, whatever barrier they might be facing. We're here to challenge that barrier and to make progress on it.
When I look at health equity, it seems pretty simple to me, and as other staff, as we believe within our organization, just because for whatever reason, when you get older, you don't have money, and for whatever reason it is, you still deserve a rich and fulfilling life. We've always felt that it's really important for those that have struggled, for those that are immigrants, for those who've had medical issues or family issues or work issues where now they're entering what we call the golden years, and they're not quite golden. We want to be there to make sure that that they get a good shake at the end of life. So that's, to me, what health equity means, is providing for those who are the neediest.
In terms of health equity outcomes in serving lower income older adults, really income should not be a barrier to accessing or having health equity. So the work that we're doing is to say that regardless of income, a person should still be able to have the support services that help them to age well in their community.
Well, if we're thinking about transgender, we are 30 or 40 years behind the equity people ask right now. So for us, equity is very important. Go to a doctor or doctor provider or clinic, and they can receive the correct help and they could receive the correct customer service. Just not laughing on them, or just doctor who cannot provide hormone therapy to a transgender because they don't understand us. It's very important. So I think equity for us is anything. We are 30 years behind, and that's why we're raising our voice to have the same quality of health to any person in the United States desire, and they have to have.
Historically, the justice system has been rooted in racist practice. It's been rooted in suppression, surveillance, control, punishment, and communities of color have been adversely impacted by that practice. Now, it gets complex when you look at different decision points and the different players. We know communities of color are over-policed versus white communities or privileged communities. But we also know that there's practices by system players and actors, from the prosecution to the probation department, that can entrench or make those disparities even worse. Essentially, when I look at equity, it's about giving access and opportunity to the most marginalized and oppressed communities and people so that they can be successful. So that's how I view equity. It's really about access and opportunity.
Yeah, so I think co-design specifically helps health equity because you're likely to design programs that are going to be more effective in addressing the needs of underserved populations, because you're going to be designing something that is more tailored to the needs of that local community. Additionally, co-design is centered in values of participation and ownership, so that the community should ideally benefit also from the process of developing and owning something.
For me, health equity, racial equity, when we look at the issues of health, education, and immigration, they are all intersectional to me. I'm a strong believer that immigration is a determinant of health. For me, I envision a world, a culture of health, if you will, where health equity is based on someone having the optimal opportunity to be healthy, to have the opportunity to get services, to get health care, regardless of who you are, regardless of where you were born, regardless of what language you speak, regardless of who you love, regardless of how you identify or what religion you practice. And you can just be you.